Hello again, and welcome back to our last segment of our discussion on the spinal cord and spinal nerves. So far we have gone through the gross anatomy of the spinal cord, talked about the specifics of the spinal nerves, and our last portion of our discussion we had mentioned the aspects of the gray and white matter. Right, just to finish up with the gray and white matter, just a couple terminology pieces here. We do see that the white matter is going to contain those axons from both the afferents and the efferent cell bodies. And we see that the ascending tracts, meaning ascending, meaning going up, these are going to carry the sensory information, which was obtained from the posterior gray horn, which got its information from that dorsal nerve root, from the dorsal root ganglion, and then the spinal nerve at that level. Okay, the descending tracts, these ones are coming down from the brain, also in that white matter. Then they're going to cross over into the gray horn, okay, the anterior gray horn, where they find the cell bodies. From that portion, then they go out through the anterior or the ventral nerve roots. Then they end up getting into the spinal nerve, and then they go out and hit their targets. Alright, so next piece we're going to take a look at is simply just a way of taking all these spinal nerves that we talked about here and then just organizing them. So a lot of different information will come from, say for instance, different sections or different regions of the spine. For instance, you might end up having, information coming from several cervical vertebrae, and then that information kind of overlaps with each other, and then so you can have several generations or origins of information going out to specific targets. Now that's helpful because, say for instance, what if one of these spinal nerves ended up getting severed? Then there would be no way to get information out to those targets. So there are these redundancies that are built into the system to allow for information to come out from many parts of the spinal cord and then reach the targets further down the way. And that's true also for sensory information coming back from the periphery, back into the spinal cord, and then going up to the brain. So the way we organize a lot of these complex overlaps and associations of spinal nerves are in what we call plexuses. So we have spinal nerves and plexuses. Okay, so each spinal cord segment is connected to a pair of spinal nerves, one going off to the left, one going off to the right. Okay, and then each spinal nerve is surrounded by those three connective layers that support the structures that contain the blood vessels, as we talked about in the last video, our dura, arachnoid, and our pia mater. Alright, so now the next piece is to look further down at those spinal nerves. Now, to draw an analogy here, if we think back to when we were talking about the skeletal muscle, we saw that the skeletal muscle's fibers were surrounded by these layers of connective tissue. We're going to see the same sort of analogous structure with the nerves. So to see if we can recall, what was the name of this layer of connective tissue that bound everything just within this, for instance, this muscle, the skeletal muscle? What was the name for that tissue? Alright, that sounded good. We're getting great participation today. So that's going to be the epimysium, meaning above or around the muscle. Now the next one we see is going to be intermixed in between these muscle fascicles, and we see that these ones end up containing our blood vessels, and this really is what separates our in-between actual muscle fibers. Okay, in between one muscle fiber collection or within that muscle fascicle and another muscle fascicle. So what was the name for this white connective tissue that's right in through here? Nice, good, paramecium. And then lastly, we have the ones that are actually inside of the muscle fascicles that are found directly in between the muscle fibers, and those of course are going to be our awesome, very good, endomysium, perfect. So then we see these prefixes and the structures that are related to them. Now when we look at the spinal nerves, we're going to see similar analogous setups. So when looking at the spinal nerves, the outermost layer, you now just change mesium into neurium, and we get the epineurium. So the epineurium is going to be that outermost layer. Then we go in deeper, and as you can see, so we started off with our epineurium, okay, that structure that surrounds the outer portion of the nerve. Then we go deeper, and we see that there's actually these whole collections of different nerve fibers in there. Okay, and in between those, again, we have blood vessels and that kind of embedded in this white connective tissue. So it's only fitting that we use the term perineurium, just like we use paramecium inside the muscles. So the perineurium, that is going to be our white connective tissue kind of embedded within, deep to our epineurium. Then last one here is going to be the endoneurium, which makes sense because we have the fibers surrounded by that endoneurium, just as we saw the muscle fibers being surrounded by the endomesium. So the endo meaning within. All right, so that's the one more breakdown of the spinal nerves, and then what we're going to take a look at next is going to be our nerve plexuses. All right, so last couple of things here, though, mentioning a couple more things about those peripheral nerves. Peripheral nerves are these interconnecting branches of spinal nerves. So they come out from the spinal cord, okay, and then they interact with each other, and then they create those peripheral nerves. Okay, those spinal nerves, we know that they are mixed nerves, okay, and we find that that's where, because they're mixed, they have both ventral and dorsal nerve roots. The dorsal, again, being our sensory or our afferent, and our ventrals being our efferent or our motor. Now there is a condition down here where you can start getting compression or you can start getting damage to the peripheral nerves, and we call that peripheral neuropathy, which simply means disease of the nerve or of a neuron. And what that would end up with is, because you do have a mixed signal coming through that nerve, is we can start getting sensory disturbances, which are sometimes called paresthesias, or you could even end up having numbness, or you can have loss in motor function. So now let's take a look at the nerve plexuses. So there's going to be a few different sets of these. The first one is going to be our cervical plexus. Okay, it's made up of the branches from C1 through C5, and we'll find that the muscles or the targets that are going to be innervated by these nerve plexuses, okay, are things found in the neck, thoracic cavity, diaphragmatic muscles, okay, including the diaphragm, which is innervated by your phrenic nerve, as well as your accessory respiratory muscles. Little FYI here with the phrenic nerve, the world record of having the hiccups was about 7 years, and what it was there was actually a tumor that was pushing up against this phrenic nerve, and just as we saw with the neuropathies, what can happen is that there can be a disturbance in that motor function. So that was triggering that signal going down the phrenic nerve, causing the diaphragm to go into spasm. So looking here at our next plexus is going to be the brachial plexus, and we see that the brachial plexus actually includes our lower cervical nerves, starting with C5 and going all the way down to T1. Just a quick review. Which two vertebrae will C5 exit between? Alright, so hopefully we got the answer here. We know that C5, like all cervical nerves except for C8, is going to be named after the vertebrae that's beneath it. So we're going to see C5 exiting between C4 and C5 cervical vertebrae. And how about T1? What vertebrae surround this one? Alright, so that's going to be T1 spinal nerve is going to be coming out between T1 and T2. Because remember, between C7 and T1, we end up having cervical nerve 8. Alright, so that is visualized along here in this image. Right? And those are nerve roots, okay, coming out in between the vertebrae. And then what we see is from the nerve roots, then we get down into our trunks, down to what's called divisions, down to cords, and then eventually we end up having nerves breaking off of each of those points. Those are the peripheral nerves. The main ones that we want to focus on are going to be found here towards the distal end of this whole nerve plexus. Musculocutaneous nerve, okay, our median nerve, which is you can remember this one because if you look at the more superficial nerves here, the one right in the middle is the median, and it looks like the middle part of an M. Okay, and then coming off here is going to be the ulnar nerve. We know that the median and ulnar nerves are going to be the nerves that end up innervating the anterior portion of the forearm. So it's only fitting that they're next to each other. On the back portion, diving deeper, going to the posterior aspect of the forearm, we have two more nerves, which are going to be the radial nerve, which is the large nerve right here, and then off of it, we also have the axillary nerve. All right, this nerve plexus is what's found in your armpit or in your axilla. So if you ever wondered why that area is particularly sensitive or sometimes painful, it's because of all the peripheral nerves that are present there. All right, last few pieces here on the brachial nerve. The cords that eventually give rise to these nerves are going to be associated as follows. The most lateral portion, running to the musculocutaneous nerve, that's going to be what's the lateral cord. The lateral cord gives rise to the musculocutaneous. Now, if we follow this lateral cord down, we see that it branches off. One part goes to the musculocutaneous. The other portion comes down here to the median nerve. Okay, and that's also true for the medial cord, which is over here. It's also coming down and branching off. So we get the lateral and medial cords coming together, and that's what makes up your median nerve. Okay, the other branch off the medial cord is going to be the ulnar nerve, which again is going to be on the medial portion of the forearm. The posterior nerves, I should say, which include the axillary and the radial, come from the posterior cord, which is actually going behind these posterior to your peripheral nerves that are found down here. Okay, last couple nerve plexuses here. We've got our lumbar plexus. The major nerve, or the major spinal nerves that make up this are T12 through L4, and the major nerves that we find related to the spinal nerve plexus, okay, found in the lumbar plexus, is going to be the iliohypogastric nerve, the ilioinguinal nerve, the genitofemoral nerve, the lateral femoral cutaneous nerve, and the femoral nerve. All right, in your packets, you should have an overview of these nerves, shown here, and their exiting points. Be familiar with these nerves and that they are part of the lumbar plexus. There's additional information here in terms of what they innervate, which should look somewhat familiar because of our discussions on muscles. Okay, real quick here, our last one is our sacral plexus. Okay, big piece here is going to be that sciatic nerve, which breaks into the fibular and tubular nerves. We find that the sacral plexus is made up from L4 to S4. And the other nerves that we can have here are lumbosacrals, our superior and inferior gluteal nerves, our posterior femoral cutaneous nerves, and our pudendal nerve. And once again, here is our overview for what nerves make up that sacral plexus, and the origins for which those nerves end up coming from. All right, so that concludes our discussion on the spinal cord, the spinal nerves, and our plexuses.